our service development has been to pioneer the use of ultrasound for peripheral cannulation. This is something that's relatively new, both locally and nationally, and allows us to pretty much guarantee first-time cannulation in every patient.
You can fully visualise the vein beforehand, so you know you're going to get the cannula in and it's going to be a successful procedure, as opposed to doing it how we traditionally do it, which is a sort of blind procedure.
You're a classic kind of patient, literally. If you've got a vein there that they could use, but if they were out of action, this arm, any doctor or nurse would come along and say, oh, there's nothing, you can't see or feel any veins here. As soon as I put my probe on there it is, huge.
It's a technique that we're very proud of, and it's a technique that we do teach to other members of staff regularly within the Trust, and we feel it's a real step forward in terms of safety and convenience for patients.
Initially, patients who attended DVT clinic, they went through the normal pathway, but then we began to question, what about the patients where we don't have a reason or a possibility for the cause of the DVT? So through that's where the virtual ward came into play. It's looking at the full care of the patient, that if there is an underlying cause, that the virtual ward, through its further investigations, would hopefully identify that underlying cause.
It's particularly caring because we don't just focus on the DVT. You know, we've had patients come in that are also suffering from other conditions, and we will also help with that and put anything in place that we need to help that patient. We don't just look at the DVT or the one thing they have come in with, we look at holistic care and a variety of things.
They've worked very hard over the last few years to improve the service for our patients, and I think they've achieved that.
What we have to remember is that we have patients that come in with physical problems, but patients with mental problems, they don't leave them at the door.
The development of this smart tool, as it's called, has really helped the staff at the front end and throughout the wards to really look at their patients and see what their care needs are.
The smart tool itself, we amalgamated together a mental health risk tool and our Kent and Medway Partnership Trust therapeutic observation tool, so that not only could staff within the General Hospital assess a level of risk, but had some practical advice as to how to maintain the safety of that person and what next steps to take, because that was really the bit that we figured was missing.
It's about caring for the patient as a whole. It's just common sense. It's just so key.
Claire is an assistant or technical instructor, and she's been working with us for well over 20 years. And what she does has expanded over time as she's become more and more expert in the field of dementia. She'll observe a speech and language therapy assessment with someone who's referred to us with dementia, and then she will go in the community and follow up that patient and work with the family and the patient and try and facilitate their communication to enable them to keep their communication and interactions and hobbies going for as long as possible. Her persistence and her calmness and her excellent communication style with these clients really does make her stand out as an exceptional speech and language therapy practitioner.
It's such a privilege to be taken into somebody's world and share their passion with them and try and support them and their families. I believe that I'm really quite lucky.